Hi, this is Haley Davis, and I'm going to be doing my informative speech over cystic fibrosis. And today we're going to be talking about the genetic aspects of cystic fibrosis, how the disease exactly works in the body, and then the treatments that patients have to go through in order to stay healthy. As far as genetics go, there are more than 10 million Americans that carry the CF mutation. That's according to the Cystic Fibrosis Foundation. There are over 1,800 mutations of the one gene that causes cystic fibrosis, and so you're probably thinking, why don't more people have cystic fibrosis? Because there's about 30,000 people in America right now with cystic fibrosis. That doesn't really seem like a big number. That's because it takes each parent to have the gene, and then there's still a 1 in 4 chance that that child will have cystic fibrosis. So it's not as if you just have one person with the gene and the child automatically has cystic fibrosis. That's not how it works. As far as how the disease works in the body, it affects the cells that excrete mucus, sweat, and digestive secretions, and these secretions are a lot thicker than a normal person's secretions, and that's according to the Mayo Clinic. The digestive system is affected because the pancreas does not give out normal digestive enzymes, and so this means that the patient has to take enzymes with every meal to help them digest their food. The lung portion of it is, like the respiratory portion, is the most, difficult, portion of the whole entire process because that's where they have the most bacterial infections. They even have fungal infections. It's where the most life-threatening issues come in hand. Many patients will end up on breathing machines, or as they get older, they'll eventually need like a double lung transplant. As far as the sweat glands go, CF patients are known to be extremely salty. This was noticed back in like the 1900s when mothers would kiss their children's foreheads and they would taste salt. And so that's where that comes in hand. And that's because the body secretes, or it has an imbalance in the salt production. And so how these patients are treated is very vital to how their health is and how long these patients will live. Depending on the mutation and depending on how much they take care of themselves or what bacteria or infections they get, depends on like how much treatment they need, how long they'll live. The average lifespan right now is about 37 years. That's increased a lot from the 1900s. It used to be children wouldn't even make it to their teens, wouldn't even make it past birth. They would be known as blue babies because they would die of respiratory complications. And CF patients do treatments daily. They take medications daily. It's not like you go to the hospital every once in a while and you just get a treatment and then you go home. They do 4 vest treatments a day. That's what this machine is. I know it probably looks like a robot, but what it is you have a vest on you, and this vest inflates, and these 2 tubes right here, they plug in, and this machine, it inflates this vest and it shakes you up so that it shakes all the mucus up in your lungs so that you are able to cough it out after a few periods of this. So the point is to try to get as much mucus out of the lungs as you possibly can to prevent infection, to prevent the risk for scarring in the lungs and whatnot. As far as medication goes, cystic fibrosis patients take a lot of medication, and the problem with this disease is that it's progressive. It never really backs off, I guess you could say. The scarring and everything that happens throughout all of the body, that doesn't ever get better. And so medications increase as their lifespan increases. These are what you would call enzymes. These are taken with every meal, and then according to depending on however many infections or things that are going on in the patient's lungs or body, they can have different antibacterial or antibiotics that they're on. They also do a lot of nebulizers with their treatments. That is to clear up the mucus, to break it down, and to help them cough up the mucus. And then other things is that as a patient gets older, they may experience a lot of difficulty breathing, and so they'll eventually be put on an oxygen tank. A lot of people who are in like they're 18 or 19 or 20, you'll start to see them with that. And then a lot of times when they're like getting into their 20s or 30s, all of this depends on you know, how well the patient's doing. They can live up to 40 years old without having any oxygen tanks, any double lung transplants. But a lot of times it seems to be that usually around their 20s, they end up getting a lung transplant or a double lung transplant. And that is just because there's really nothing else you can do. Some patients choose to not get the transplant and just to try to carry it out. And then other patients, they get the double lung transplant, and it either works out and they do really well for a few years, or their body can actually reject the lungs, and that's a whole entire other process in itself. So it's never really an easy, ongoing situation. And so the reason that all this is really important is I just wanted to share a little bit about the importance of gene therapy. Cystic fibrosis is just one of the many things that you can get from, you know, not being aware of what gene mutations that you have. And so, you know, always be aware of, you know, what's going on with you and what your child can have in the future. And so thank you. And then here's my audience.